Welcome to Nursing 508, Advanced Research and Scholarly Inquiry for Advanced Nursing Practice, Module 11. This week we're discussing purpose, data collection, and outcome measures. These concepts are part of both EBP and research. When we talk about implementing an EBP project, we think of action, but there is a lot of thinking and deciding that needs to be done before any action can happen. The planning that must occur prior to implementation of a project may make or break the project. The purpose of a research or EBP project is typically preceded by recognition of a problem. A problem can be identified via clinical practice, interactions with researchers, literature reviews, theories, or funding sources. Practicing nurses may notice areas where there is inadequate policy in place, patient outcomes are not ideal, or practice varies among nurses. Any of these situations may lead a nurse to identify a problem that needs investigated. Researchers frequently interact with one another at research conferences. Nurses interested in a particular area of research are typically familiar with other nurses who have performed research in that area of interest. Oftentimes, it is conversations among these nurses that serve to identify problems. Professors in nursing programs may identify problems when working with students on EBP projects, theses, or dissertations. Literature reviews are another potential source of EBP and research problems. A nurse may find a study with reasonable findings that was completed with a sample population that varies greatly from their own practice population, and thus identify as a problem the need for replication of the study with a different sample population. Gaps in knowledge are other problems that may be identified via literature review. Problems may also come to light when theories are explored. A very common source for potential research problems are funding sources. Oftentimes, sources like the federal or state government will identify problems on which they are willing to fund exploration. A word of caution regarding identified problems. Frequently, problems are too broad to be addressed in one EBP or research project. It is usually more appropriate to identify one aspect or area of a problem on which to focus your EBP research project. When a problem is identified as a potential EBP or research topic, it is important to determine the significance of the problem. A problem may exist, but unless it has some significance to practice or is of importance to patients, families, healthcare systems, or society, it should not be undertaken as a project. There are examples of projects that have been undertaken simply as a matter of curiosity, but that is not a valid reason to pursue a problem. Problems that lack significance will not generally receive support from administrators, funders, or facilities. The background of a problem is an important part of the EBP and research processes. It is an integral part of the development of a topic, a purpose, and as you'll read in Chapter 28 of our text, an EBP or research proposal. In a proposal, as well as in the introduction of an EBP or research article, it is necessary to convey why the project was warranted. The significance and background of the problem is what you will develop and present in your proposal and introduction to justify your project. The problem's significance, background, and statement are utilized to develop the purpose of an EBP or research project. The purpose of an EBP or research project must be clearly defined and must not be too broad nor too narrow. In a proposal or article introduction, the purpose must be explicitly stated in an objective manner that does not suggest what the outcome is anticipated to be nor reveal any bias. The purpose of the project is presented after the problem, program, and statement, background, and statement, which should serve as logical evidence that the project is warranted. The purpose can be revisited throughout the project to determine that the project is staying on track and not straying beyond its predetermined course. Although information may be gained during the course of a project that is beyond its purpose, that information can be recognized as part of the discussion, but it should not become the focus of the project. Recommendations can be made for future projects to address any such information gained beyond the original purpose, but the purpose of a project cannot be changed mid-course. In addition to determining the problem your project will address and the purpose it will serve, you will also need to establish a plan for data collection. The level of detail required is quite significant. You need to plan out data collection specifics and strive for consistency throughout the process. As you will see when you work on the IRB submission, The authorizing agencies want to know exactly what data you will collect and how it will be handled. What data will you collect? The purpose of your project will direct what data you collect. The levels of data measurement collected will determine the type of analysis you're able to do. How will you collect your data? There are a multitude of ways to collect data. We'll discuss various instruments and aspects of measurement later in this lecture. All instruments have pros and cons associated with their use. Who will collect the data? If only one person collects the data, then it is much easier to ensure consistency. With a team of data collectors, training needs to occur to minimize variance in the data collection process. All data collectors should undergo city training. Where will the data be collected? Again, there are many options, each with their own pluses and minuses. You need to consider participant, patient privacy, and confidentiality when determining where the data will be collected. When will data be collected? Before implementing a project, you'll determine timeframes and end dates for data collection. All aspects of data collection should be carefully planned out ahead of time. As I just mentioned, detailed plans regarding data collection and management are required prior to implementation of any EBP or research project. When considering what instrument you'll be using for data collection, you need to evaluate the formatting, consider the length, the difficulty in completing the form, the time requirements, etc. Procedures or protocols for data collection need to be written out in detail, and all personnel trained in proper data collection and use of the instrument. The number of people with access to the data should be minimized, as the greater the number of people with access, the greater the risk of improper handling of the data. Data must be stored in a secure area. Electronic data must be on a secure, password-protected server. Consistency, as previously mentioned, is key in data collection. Recruitment processes must be spelled out in detail for IRB or agency approval. Informed consent for research projects must spell out exactly what data will be collected and what will be done with that data. I know I've said this multiple times, but the most important aspect of measurement is consistency. Without consistency, the measurements are meaningless. For example, when measuring ascites, if we don't mark the abdomen where the measurement was taken, then we have no way of knowing if a subsequent measurement indicates an increase, decrease, or change in location of measurement. Some measurements are easy to quantify, such as urine output or heart rate. Others are more difficult, such as anxiety, anger, or patient satisfaction. The advantage of a quantifiable measurement is that it gives meaning and preciseness. For example, describing a person as tall does not give as much information as providing their height in feet and inches. Numbers are not vague. They serve as a communication vehicle when measurements are quantifiable. Measurements can be direct or indirect. Concrete factors such as height, weight, time can be measured directly. Technological advances have increased the availability of direct measurements of many physiological, biological, and chemical characteristics. In nursing, oftentimes the concept being examined is an abstract one, such as stress, caring, coping. The first step in measuring an abstract concept is the development of a conceptual or operational definition. An example is the conceptual definition of non-compliance, the extent to which a person's behavior fails to coincide with the therapeutic plan agreed upon by that person and results in ineffective outcomes. With that conceptual definition, you might measure behavior, exacerbation of symptoms, failure to progress, cultural influences, or health as indicators of non-compliance. Another example of measuring indicators of an abstract concept when you're not able to directly measure the concept is in infant pain. Indicators of pain that could be measured include heart rate, blood pressure, facial grimaces, or cries. The Pequot question should direct the method of measurement utilized. A method must be chosen that can accurately measure the outcomes being examined. This is a list of measurement methods commonly utilized in EBP as outlined in our Grove text, Chapter 17. There are subsets of all of these methods. For example, interviews can be structured, semi-structured, unstructured, /open-ended. Each of the methods has strengths and weaknesses. No method is perfect. There is always some measurement error. Measurement error is the difference between what actually exists in reality and what is measured by the instrument. As mentioned, measurement error will always exist to some extent. Factors that can influence measurement error include situational contaminants, such as the Hawthorne effect, the environment, distractions, rapport with the researcher, response set biases, such as age, ethnicity, gender, transitory personal factors, such as fatigue, hunger, mood, attention span, administration variations, such as varied wording utilized in interviews, collection of physiologic data at different times or via different methods, item sampling, which items were used to measure an attribute. In order to minimize measurement error, you want to use an instrument that is reliable and valid. Reliability refers to the consistency of a measurement instrument. We've heard that consistency word a lot in this lecture, haven't we? If the same measurement scale is administered to the same person at 2 different times, the measurement is reliable if the answers remain the same. If the oral temperature is recorded on 10 people every 5 minutes 10 times using the same thermometer and the readings are the same, then the thermometer is said to be reliable. If 2 researchers observe the same event and complete the same instrument and their observations are compatible, then the instrument's reliability is supported. Stability is one indicator of reliability. Test and retest determine stability. This works well for physiologic measures, such as taking and retaking of blood pressure, but for less direct measurements it can be more difficult. For example, if you give people a questionnaire and then go to retest with the same questionnaire, they may just simply put the same answers they originally put because they remembered them. Or if you're asking questions about quickly changing concepts such as anger or sadness, then the answers may change despite the fact that the instrument is reliable or stable. Internal consistency, also known as homogeneity, refers to each item on an instrument measuring the same attribute. This is evaluated by comparing scores on half of the instrument with scores from the other half of the instrument. If the scores are compatible, then the instrument is said to have internal consistency. Equivalence is when 2 versions of the same questionnaire or 2 observers using the same tool result in compatible results. Sample population may impact reliability. If the participants are homogeneous and reliability is designed to measure differences, then would the reliability scores be high or low? They'd be low. It would be like having a Likert scale where everyone just answered right in the middle and there was no knowledge gained. Validity of an instrument refers to the instrument's ability to capture the data that it is intended to capture. Validity is related to reliability, but is different. For example, if your scale at home reads 140, 140.5, and 141 on 3 different days, you may say that that scale is fairly reliable. However, if your true weight is 120, then your scale is not valid. Unlike reliability, which is established by collecting data with a measurement instrument, validity is not established through use of the instrument. Statistical procedures such as Cronbach's alpha are used to estimate validity. Validity can never truly be established or determined, only estimated. A panel of experts can be utilized to assess validity of an instrument. Each expert would review the instrument and provide feedback. If the topic expert's feedback was consistently positive, then you could say the validity was supported. Comparing the content of an instrument with the elements of the construct being measured, as outlined in the existing literature, will also give you an idea of the validity of an instrument. When developing an EBP or research project, you may be tempted to simply develop your own tool for measurement. I would strongly urge you to reconsider, as developing a reliable and valid measurement instrument is extremely difficult and time-consuming. If at all possible, locate an instrument that has already been developed and had its reliability and validity determined. If you proceed with an instrument with poor reliability or validity, then the data you collect will be meaningless. There are instruments available to measure almost any construct you can imagine. There is an entire database just for measurement tools, the Health and Psychological Instruments, HAPI database, and many instruments can be located in the databases that we all frequent, such as CINAHL, PubMed, etc. Data collection is commonly thought of as part of an EBP or research project. However, oftentimes the data collection is completed is also completed prior to implementation of a project. Data collection beforehand may be done to justify the project by establishing the existence or degree of a problem. Data collection done after a project is typically done to demonstrate outcomes. In an EBP project, the facility's internal evidence can frequently be utilized both before and after a project. The EBP article in this week's readings provides potential sources of internal evidence. Proposals are typically required for EBP and research projects. The IRB submission that you're working on this week within your discussion board groups is an example of a proposal. The reason that IRB review is typically required for both EBP and research projects is because there is data collection and dissemination involved with both. There is also commonly confusion regarding exactly what constitutes research versus EBP, and the IRB review typically makes this determination. When the IRB determines that the project is EBP and not research, it can typically undergo a more expedited review. Proposals, including those submitted to IRBs, generally include the problem, purpose, framework, variables, design, sample, ethical considerations, data collection analysis, and findings dissemination plans. The depth required in a proposal varies depending upon your audience. IRBs typically require in-depth information, as do government agencies considering proposals for potential funding. The purpose of a proposal is typically twofold. One, the quality of the proposed project is evaluated to ensure that the project is performed according to ethical standards of the approval agency. Two, the impact of the proposed project is evaluated. Frequently, proposals are returned with required revisions necessary, so do not get discouraged if you submit a proposal and revisions are requested. Once the revisions are made, the proposal may be accepted and approved. All of the topics discussed in this lecture apply to both EBP and research. In addition to assisting with the completion of the group IRB assignment, this information will hopefully aid with appraisal of these aspects of the studies you're reviewing as you complete your draft EBP/SOS paper. Please post any questions under the course communication tab so all can benefit. Have a good week.